we're going to get started. For those of you who don't know me, I'm Christina, and I kind of do a lot of the planning for these events. And it's our last event of the semester, and we're really excited to have Dr. Jeffery Jones here today. And I just kind of want to make a couple announcements. We're going to try to have some events this coming summer to kind of get the upcoming and new class incorporated into a little bit of what Timmy is and what we do. And also we're having a group of 5 people go to the Dominican Republic in a couple weeks, which we're really excited about. And we're also working to plan a trip this next year. So for those of you who didn't get to go this year, we're really looking forward to getting something going on next year. So please join me in welcoming Dr. Jeffery Jones. And he's with St. Francis, and he's going to talk to us today about tropical diseases that I see. Thanks.
Thank you. Thank you very much. Hey, can you all hear me okay? Okay. Well, I know you folks are sort of in a month-long time of testing and busy, and we could spend hours talking about the minutiae of life cycles, but we're not going to do any of that. What we're going to do is talk about a few cases to try to illustrate some bigger pictures. And the theme that I really want to bring about is talking about some of the neglected tropical diseases. And there's actually a fairly specific listing of that, so that's what we're going to talk about. And I encourage you just to sort of sit back and listen and look. It also gives me a chance to show off some of my slides. I spend a lot of time working in other parts of the world, most recently with Timmy. Be glad to talk about any of those experiences privately if anybody wants. But let's just launch in and talk about the first case, Abasi. Abasi is a Tanzanian boy who is 5 years old, but if you looked at him, you would think he was maybe 3, given his stature. And you can see someone has kindly, maybe I can make that work, given him some shoes that don't quite fit. The thing that's very curious is this is Abasi's palm next to the palm of his mother. Oh, this is going to be mad. I think I'll just set this right here. And you can see that he's so incredibly pale. Okay, so a stunted growth in a young child from Tanzania, and who recently got some shoes. This combination should lead one to think about, why is this happening? And very quickly launches you into the notion of helminth infections. Helminths are worms, cause a lot of problems in the world. And if we think about the population of the world, something like 1 in 6 people have these. I mean, they're not at all uncommon. And I'm going to just give you sort of a whirlwind tour of some of those. We think about Ascaris, which is the roundworm, Trichuris, which is the whipworm, and then hookworms. But these all are acquired through either coming in contact with the soil that's contaminated with the eggs, either through mouth or, in the case of hookworm, through skin. And so it's extremely common in the world to find these in children. And just to add to your dining pleasure, Ascaris, this is the giant roundworm. You don't miss these. I mean, there's only one thing that big, and it terrifies people. And in the United States, if somebody passes one of these, we call it a worm emergency because they run to the emergency room. But actually, it's one of the few parasitic diseases you can diagnose on the phone. When somebody says, "Oh, I passed this. This is big," they don't do just a lot of damage. About 1 billion cases a year, a lot of disability-adjusted life years lost to this, though. And I'm going to develop this theme as we go along. So not a lot of mortality, but a lot of morbidity. And there's only like 20,000 deaths a year. And these worms have a way of crawling into little orifices and causing problems, obstructions, that sort of thing. Or if you're dealing with somebody who's got a fever, they come crawling out of the nose, which it unnerves everybody, but they don't do much harm. This is what a whipworm looks like. And so these are macroscopic worms. And this is the second most common soil transmitted helminth. And again, lots of cases, lots of DALIs. And this is something that is fecal oral, so it's going to be coming in through the mouth. And it takes a while to develop. these once you're exposed. And then this guy is the hookworm. That's actually the lining of the gut. And these characters actually attach to the gut wall, where they then feed on that tissue and blood. Now, as you may know, in many parts of the world, there's a real struggle for iron. That iron is a rate-limiting step on how things can grow. And these guys, because they consume a lot of blood, cause problems. It's very common. You get this from running around barefoot. And it is human to human, but via the soil. So it's essentially walking on or having skin contact with soil where the larvae are. You can get it from ingestion, but that's not so common. And this is another name for it is tropical anemia. And so this is a parasitic disease that's responsible for just a tremendous amount of anemia. And as you can imagine, little kids in Tanzania also get anemic from malaria, and there's other reasons too. Nutritionally, they're not the most sure. So, but this is sort of, these worms are essentially in competition with their host for limited numbers of nutrients. And that can cause problems because you're trying to grow. And these guys can live a long, long time. 15 years is not we know that it can be that long. So what's the bigger picture here? Well, for these kids, they're in competition with their parasites for limited nutrients, and they often lose. And so you get stunting of growth. You get iron deficiency anemia. How does this play out? Well, performance-wise in school, they're malnourished, they don't do so well. And then one of the difficulties, one of the perverse difficulties is if you have somebody who then is iron deficient, the body tries to adapt by absorbing these metals better. Well, if you happen to be around lead, you absorb lead a whole lot better too. And so the double whammy, you have somebody that wasn't doing so great because of their nutritional issues, and then you introduce lead. And so their neural development really suffers in that situation. And one of the points I'm going to make is if somebody is in poverty, those conditions set up circumstances to ensure they stay in poverty. And that's one of the themes that we see with the neglected tropical diseases. You probably haven't gotten to this point in your careers yet, but these are actually fairly easy to diagnose by looking at stool samples. Under a microscope, there's different eggs for the scarus and lipworm and hookworm, and these are all very characteristic, and I'm not going to go into that. It's sort of interesting to me, but the point is just these are common. And also, you can treat them. This is not hard to treat. There's medicines that work, and on brigades when you go out, the empiric treating of children for parasites is part of it, essentially a deworming agent, and that works. It helps with development, it helps with school performance, so these are very useful things. These are also things that can be prevented. And what we start talking about first is how can we have hygienic treatment of sewage? And that's lacking in a lot of parts of the world. And so the lack of infrastructure is part of what keeps this going. If you don't have shoes, your risk goes way up. So getting shoes on people, hand washing, surveillance and chemoprophylaxis, that's what a lot of the people do on these brigades. And another curious thing and sad thing is it's very feasible to develop a hookworm vaccine. But the question is, who's going to buy it? And again, one of the themes that I'm talking about is that these things, there are interventions, but if you can't pay for them, how do you do it? And that's not all bleak, but it brings up some interesting questions. Now, moving on, this is Beatrice, a woman in Haiti, and Beatrice's problem is this incredible swelling of her left arm. You can see it's much bigger than the that doesn't bother her so much. The thing that bothers her is that for her and her community, she is no longer marriageable. Okay? And that may seem sort of trite compared to health issues, but it's not. I mean, socially, this is very, very stigmatizing. And that's another theme of the things I'm talking about. There's often a stigma associated with them. This is due to something called lymphatic filariasis, and again, it's another kind of helminth. Worcestershire Macroscopic is the culprit in most of these in the world. And with this, it's a kind of filarial worm that gets transmitted by a mosquito, and then it gets into the lymphatics where it starts to block them. And so long as the worm is alive, you don't do too badly. Then if the worm dies, you get a lot of scarring in the lymphatics, and you start to swell. And so you get obstruction of the lymphatics. This is sort of where you see this. It's not uncommon in the tropical world. And again, this is not parasitology, but you can look at these worms in the blood and speciate them. And I'm not going to go into that very much. It is a curious thing, though, because the microfilaria, which are how this thing propagates, only come out at night when the mosquitoes are biting. So it's an interesting adaptation on the part of the parasite and mosquitoes working together. And if you're trying to diagnose it, unless you want to do these tests in the middle of the night, you won't find it in the blood, which was a big stumbling block for a long time. And this is, you will hear the term elephantiasis, and that's what causes this. So this woman has elephantiasis. Sometimes you will get this verrucous kind of edema. And what's going on here is you got the lymphatic obstruction, but then you start to get secondary infections. And that is a double whammy, because then you get an infection in a limb with poor lymphatic drainage, and then it gets worse. This is not a trick of foreshortening with a camera. This man's testicles are about the size of footballs, okay? And in men, there's a certain tropism for the lymphatics in the scrotum. And again, this is highly stigmatizing. This is something that would keep him from being marriageable. Some of these people are asymptomatic, but they, in addition to having the deformity, they get fevers. I mean, they get sick with this. Fortunately, now there's a kind of card test that you can use, so you don't have to go looking for these folks at 2 in the morning to see if they have microfilaria in their blood. You can use these little card tests, and they're quite good. And there's treatment. You know, you sort of pick 2 out of 3, ivermectin, DCR, bendazole, and they work. So it's not that there isn't treatment. It's trying to get the treatment to the people who need it, trying to find out who has the problem, and then trying to prevent it. And there's been a lot of work done, much of this in Haiti, about using DEC and everyday salt to try to prevent transmission of this. If you can avoid the bites, that's good. And in many of the parts of the world that have this, they also have malaria. So if you could use mosquito nets, that would also lessen the risk of lymphatic filariasis. So there can be some benefits, mutual benefits on these preventions. If somebody already has it, the real key is trying to prevent the secondary infections, because a thing like this little fungal infection, this can blow up to make her leg twice as big. And so teaching people how to look for these things and to have early treatment so they don't end up with these deformities can be quite useful. Okay, this is another young woman from Kenya, and you can see she's got a pretty protuberant tummy, and this can be due to a lot of things, including malnutrition or mascaras, and that can do it too. But hers was a little different because she'd had bloody diarrhea, and then she'd had this big belly and a lot of pain. And this is one you may not know. It's something called schistosomiasis, or in Africa it's commonly called bilharzia. And it's a kind of fluke, a blood fluke. So people who are in direct contact with fresh water, if you get in the water, I'm not going to go through the life cycle, but this is something where trying to keep children out of the water and keep them from peeing in the water, that's part of it too, is really difficult, especially in hot environments, tropical environments. So this is something that's very hard to control. This is what the beast looks like. That's actually the male and female together. They live with the female in this groove in the male. And this thing here is a sucker where they attach to the veins and surrounding the colon or the bladder. And again, these live a long time. So if you get this, you're going to be sick for a while. This is actually a mouse or a rat, I forget, but you can see these are macroscopic. You can see them in this vial. So they're very clever in terms of evading the immune response. They can keep on living. They can cause problems. What kind of problems? Well, when you first get them, they penetrate the skin and you can get a cervical dermatitis. Some of you may have had what's called swimmer's itch in Indiana, if you go in lakes. And that's actually an avian cysticercosis. So it doesn't ever penetrate, except it can cause a dermatitis. And that's what we have, and it doesn't really harm us. This is a marker for them getting in you, and then if you get this, you develop an immune response, and usually 3 or 4 weeks after you get the infection, you can get this what's called acute schistosomiasis. It's also called Katayama fever, and this is a kind of allergic reaction. If people get a fever, they feel terrible. It's impressive to see, but it's an allergic reaction. And this is a gut. There's different species, and some of them tend to have tropism for the gut, and they tend to cause this blood loss, and you can get bloody diarrhea with this. You get scarring, so you limit absorption. So again, the limited nutrition they have, you can't absorb what you're eating as well. But you can also get one that goes to the renal system. I understand you're studying that now, or very nearly so. I don't know if you've even had reference to this, but this does the same thing, except it's in the venous system surrounding the bladder. So these things actually lay eggs, penetrate the wall of the bladder, and so if you strain urine or look at urine sediment, you can see eggs for these. And that's the idea. You pee it out, back into the water, it goes to a snail, and then the life cycle continues. But this can cause hematuria. You can see on the cup here, it's pretty obvious that person has problems. Eventually you get blockage, hydronephrosis, kidney failure. Cancer of the bladder is associated with this. These genital lesions actually predispose people to HIV. So again, it's the double whammy or triple whammy. Okay. And it can present in a couple ways, but if you get a lot of these eggs floating around, you get scarring of the liver, and then you start getting liver disease and pulmonary hypertension, you get this big belly, and that's what our patient had. This just shows, you often find it in areas where there's lots of water, and then there's got to be snails. That's a critical piece of it. Depending upon where you are in the world, there are different species, and we almost have none in the Americas, but Africa has a lot, Asia has a lot. And you can diagnose this by looking at stool samples or looking at sediment from urine. This is something you can actually do in the field. And one of the interesting things, if you're trying to work with a population to help get rid of this, is you can go to a village and essentially have kids bring in stool and urine samples, and then right there you can look and see if they have it. Now, we tend to do this epidemiologically, like you'll go into a village and try to figure out what percentage of the people have the problem. And if it's sort of sufficiently high, then empirically you may just want to go in on a regular basis and treat. So you don't have to do the test each time. Although with this one, things like ultrasound or just do you have blood in your urine are pretty good screening tests. There is treatment, praziquantel. It still works well. There's a lot of worry that this may become resistant because essentially we only got one drug right now. And so there's not a lot of emphasis on developing new drugs for these rare or neglected tropical diseases. And that's one of the other points I want to make. I'm going to talk more about that at the end. And you can control it. I mean, you get people peeing and pooping in places where it doesn't get into the water. And then you break the cycle. But that's harder than you might think. There's potential for a vaccine, but there's no incentive. Curiously, in Asia, where water buffalo can get this, there's actually some incentive, not for the people, but for the water buffaloes, because they have value. I worked very hard not to become cynical with this stuff, but it is difficult because you see what really makes things happen in terms of vaccines and preventives. I did a lot of work in Peru, and if you start looking at people, or Zach will tell you in Ecuador, you see this too, you start seeing these interesting scars, great big scars. This is Fernando, and he came in not because of the scar, but because of horses. And if you look at Fernando's throat, you can see there's something funny going on in his throat. And this is what we call mucocutaneous leishmania. This is a kind of protozoal parasite. It started on his skin, but then it metastasized to the soft tissues in his throat. And this can progress to what's called a spongia in those parts of the world, where you essentially get a collapse of the palate and an incredible deformity. And as you might imagine, again, this is very stigmatizing. If you get this, I mean, you're not wanted. So this is a kind of protozoal parasite. It's spread by a sandfly, and there's some reservoirs of the disease in various animals. So these animals tend to live in proximity of people, and so you keep the cycle going. It's an intracellular parasite, which makes it very difficult to diagnose. And essentially, it takes some fairly specialized testing to know definitively. This is the vector, the sandfly, and these are little guys. They have a painful bite, but they spread these, and there's different species in both the New World and Old World, and you can see this is sort of what the distribution looks like. So a lot of people just get this on the skin. We call it cutaneous. And depending upon the species and the immune response, it may or may not convert into one that can metastasize. You can also get a visceral form, which is seen more with Old World Leishmania. And it can look a lot of different ways, and we call this a pizza lesion. And you see these fairly commonly. It's the cutaneous Leishmania. Sometimes it'll attack the ear, and these are often in the people that are working out in the jungle. But all of these, this is a group of people, you look at these young women, all have these ulcers. And depending on the species of sandfly, some of them bite low, some of them bite high. It's very curious how it works. Now, most times, these will just heal up, and you're done, but you're left with a scar. So if you see people who have had this, you pretty much know what it is. Sometimes you deform the person because of that. Or it can start to heal and then it reactivates. And sometimes you get this mucocutaneous thing where it starts to really attack the palate. And sometimes it just makes big holes in the palate, and pretty soon it's compromising airways, and people don't live very long when that happens. And then this visceral, it's hard to illustrate this, but this is the spleen of this person. And these visceral forms, people don't do well. They tend to die unless you make that diagnosis and treat it. And it's not always an easy diagnosis. In Africa, you do sort of spleen taps, where you put a needle right in the spleen, suck it out, and look for it. But that has some risk. Here we do more with scrapings and injection saline, and then suck it back out. We can do PCR here to get the species, but in most of the world that's not available to you. And there are treatments, but by and large the treatments are the same ones we had 100 years ago, with one exception. There's some Elephantiasis is newer, and that's nice because it's a pill form you can use. But most of these are old poisons, and they are poisons. I mean, when you start talking about treatments that carry 5 or 10% mortality, you have to really wonder about your treatments. And trying to get interest in treatment is tough. Now, we're going to talk about this, and then we'll sort of come to an end of these cases. But this is Sergio. This is a man I met in Peru, and he actually came into the clinic because he was having trouble using his hands. And most laborers here are manual labor, so if you can't use your hands, you're in trouble. And a couple of things to your attention. One is he's starting to lose hair, his eyebrows. So if you look at his hands, look at the shadow here. I don't know if you've done your neurology rotations, but you start to lose muscle mass, and so you have this atrophy in the intrinsic muscles of the hand. And once I saw that, I wanted to see his feet, and you can see his toe is resorbing. Okay, anybody know what this is? Leprosy. And you read about leprosy from biblical times, but leprosy is alive and well. You find it in many parts of the world. It's probably the most stigmatized disease, and it has been for millennia. And this is paradoxical because it's treatable. It's very treatable. It's just another kind of mycobacterium, so it's related to TB, and it's probably a respiratory spread, but no one knows. It probably has an incubation period of 3 to 5 years, so it makes it pretty tough to study. And it's a zoonotic. We know that, like in the United States, armadillos, they're where you find it, and people who handle armadillos are at risk for leprosy. This is sort of a visual interpretation of where it's most common, which would be in India and Brazil, but you can find it in a lot of other places. And it's a bit difficult to make a diagnosis because you're trying to actually find the bacilli, and just like with TB, where you might stain them, you can look for acid-fast bacilli. But when you have only a few, it can be tough, and so there's not the kind of diagnostic tests you would like to make this diagnosis easy. Depending on how you respond to it immunologically, you can get a couple of forms. There's one called tuberculoid, means you have a really good cell-mediated response. And so you're attacking not only this, but all the tissues around it. And that can cause some problems, but first you attack the nerves too, and so you get anesthetic skin lesions. And you get these macules, but they're pretty sharply demarcated. If you actually look at nerves, you can find that the nerves themselves are large. People don't sweat normally because they've lost nerve function, and of course decreased sensation is pretty common. So this sort of illustrates that. You can see these sharply cut out lesions. And if you actually took a little wisp of cotton and were trying to evaluate sensation, you'd see that where these macules are, it's numb. And that's a cheapest little clinical aid you have. A piece of cotton or a piece of grass can allow you to make this diagnosis. Probably, you never know with certainty, but there aren't many things that cause macules with hypopigment that are numb. And this is another lesion here on the face. And it's curious because there are many kinds of skin lesions that can cause hypopigment. And the difficulty is if a parent has a child where there's a white lesion, this in and of itself is very stigmatizing. We hope that they'll bring them in because they're sometimes willing to sort of write them off at that point. And of course, many things do this. And if you have somebody come in, if you're working in the field, just testing to see if there's sensation. If there's sensation, you can reassure the parent and the patient. You can get nerve lesions with this, and that can cause all kinds of paralysis and contractures. So you can see that you start getting neurotrophic kinds of problems where then the bones start to resorb. This is not an unusual thing in untreated leprosy. If you have a lousy immune response to it, you get a lot more bacteria, but you don't do as much damage immediately. And this is called leprosy leprosy. And this is something that tends to cause increase in pigment and these plaques. I'll show you some pictures. This is like early on, and then this is later, and you can see a lot of the cooler areas of the body get this the worst. And there is treatment. The thing that's very perplexing on this is, people in the world aren't stupid. This is stigmatizing. They know that it's possible to treat, but they can't quite get past the stigma. And so if somebody in the family gets this, for all intents and purposes, that person's dead. And when you think about trying to live in a system that relies on other people, this makes it very difficult. And to this day, when I go to different places, if they have leprosoria, which is where these people go to get treatment, but often they can't leave because no one will allow them back because they've been ostracized. And this is very sad because there is treatment. Prevention, I don't know if you're familiar with BCG vaccine. It's used in most of the world to help prevent the worst types of tuberculosis, but this also helps to prevent leprosy. So it's a useful thing. If you detect it early and you try to detect it before anyone knows what it is, and then you get treatment before the person is stigmatized, it's very easily treated. And I'm not going to go into that, but there's work being done on a vaccine as well, just for this. So what kind of picture have we painted here? The neglected tropical diseases are really, it's a group of diseases that don't get much money, they don't get much recognition, but they cause an incredible amount of problems. With the Millennium Development Goals, this was sort of stated: HIV, AIDS, malaria, TB, and other diseases. And it's these other diseases that are commonly called the neglected tropical diseases. We talk about, the number 19 is probably about right, but there's always things that are being added or taken off. And I've talked about maybe 5 of those, but we could have a lecture on any of these. It'd be pretty interesting if you like tropical medicine. But the point is, these are things that all have significant problems. Except for dengue, which is emerging, it's becoming more common. Most of these are not emerging at all. They've been that way forever. Why are they important? Because they hit the world's poorest people. And if you looked at, now I think there's roughly 7 billion people in the world. If you look at the bottom 2 billion, that's where these are going to be especially well represented. And in that grouping, they will have at least one of these. A point I'll drive home again, but they are derived from poverty and they cause continued poverty. And so if you're trying to help people get out of this, you've got to attack some of these things. They have a fairly high prevalence. They're more in rural areas. They're ancient. They're chronic. Many times they cause disability and disfigurement. High disease burden, but low mortality. And when you have these high morbidity issues, it's really difficult because it keeps people from supporting themselves. Very stigmatizing. What's the disability adjusted life years look like? Well, it's pretty close to HIV/AIDS. Yeah, it's above malaria and TB. Now these are 2006 figures. This will bounce around a little bit, but it's a big deal. And the other thing that is very difficult is many times they're additive or maybe even multiplicative with HIV. So I don't want everybody to leave thinking, oh, this is headed into the ground. There's actually some reasons to be hopeful about this. The people that are working on this have come up with sort of a rapid impact package where you can go in and with a very inexpensive set of meds, you can treat them. You can get rid of a lot of these. You can control them. And there's been a lot more emphasis on this. People are starting to understand that, yeah, it doesn't, even though there's not much per capita expenditures available for pretty small amounts of money, you can make some changes. And here's the thing that I find delightful. Back when I was in your circumstances several hundred years ago, scientists were always eager to talk and share. And then came the Reagan years where money dried up, and then it was all about profit, and then no one talked. That's sort of where it is now. Because there's no money to be made in the neglected tropical diseases, everyone talks. And there's a lot of nonprofits now that are making meds, and they're talking. There's a lot of excitement here because people are starting to work together. It's not about protecting profit, it's about finding treatments and vaccines. So that's very, very encouraging. There's some initiatives that are taking place politically on these drugs for neglected disease initiatives and the Office of Global Health Diplomacy. And you think about what that means. I mean, if you can offer something to help some of the poorest people avoid these things that are keeping them poor, that's a really important thing. And it can be very valuable if you're working with the country. And they're not necessarily that expensive. So, hopeful things. Another reason to be hopeful, Bill Gates. Bill and Melinda Gates Foundation. They're going to sort of almost single-handedly shape this whole area. And really big amounts of money pouring into this. And that's very, very encouraging. Now, I know you have a ton of things that you talk about and are studying, you're busy, but if you ever want to learn more about this, there's a wonderful book from Peter Hotez called Forgotten People, Forgotten Diseases. I recommend it highly. If you just want to learn a little bit more about these things or get some more specifics, both the World Health Organization and the CDC have excellent sections on neglected tropical diseases. So I hope this has been a useful thing, or at least a somewhat entertaining thing, to see about what's happening in the rest of the world for some of these more unusual diseases. We don't see them very much here, but if you go out in the world, you will see them. So I wish you well, and I would be glad to take any questions, or I'm going to be hanging around for a while afterwards if you have more individual questions. Thank you.